The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello, I'm Dr. Emerson. I'm Medical Director at Eden Valley Lifestyle Center. I wanted to share with you today some concepts about diabetes. This is continuing on a talk we've done previously, and in that talk we discovered that diabetes state can actually be brought on fairly quickly with oils and animal fats. Dr. Sweeney did this in 1927 with 6 medical students. Was able to induce the diabetic state in about 2 days. He was unable to do the same thing with high sugar or high starch diet. We found that this has been confirmed in human studies and animal studies since then. At this time, we'd also like to look at some other aspects that can affect insulin resistance and diabetes. What we found initially was that when you take a sugar or a starch, this is a review, blood sugar would go up, the pancreas would sense that, release insulin, and insulin acted as a little key which would go into the cells of each of the doors, open up the doors, allow sugar to leave the blood, go in the cells, and be burned. This would bring your blood sugar down, and that's the way it's supposed to work. What we found is the animal products, the fats, the oils would tend to go in to the body when they're ingested and then plug up those insulin receptors so that now when you take a sugar or starch, blood sugar goes up, insulin's released, can't get in the keyholes, doors are shut, and the blood sugars rise because they have nowhere to go. And that was essentially what we covered, and that's how insulin resistance can be induced actually fairly quickly. There are some other factors that we now know affect diabetes as well. Among those are the understanding of what fiber does for us, fiber in the plant foods, also something called the glycemic index of foods and carbohydrates, and also something found in grains that whole grains have, which help protect us against diabetes, but refined grains do not have. So firstly, what does fiber do to protect us from diabetes? Actually, one of the things fiber does is it acts as a sponge. When it's eaten with sugars or carbohydrates, it hangs on to fluid and sugar, and that fiber helps release the sugar into the bloodstream from the gut slowly over time. When fiber is not there, we tend to get a rather severe jolt of sugar, which is released into the bloodstream fairly quickly. This was illustrated in some tests done with apple juice and apples. What they found is that if a person eats an apple which has the sugar with the fiber, the sugar is in the gut and it's absorbed by the fiber and it's released into the bloodstream fairly slowly. The sugar rises, the pancreas senses this, releases a normal amount of insulin, and this helps slow the rise and helps prevent the blood sugar from going too high. Maybe it stays below 150 and then it starts coming back down. And as the sugar drops, the insulin levels drop as well, and the sugar plateaus out at about 100 or 90 or so and does not drop too low. And this is the way it's supposed to work. If, on the other hand, we take that same apple, the same calories, same 100 calories, and take it in the form of apple juice, what we find is when that's entered into the gut, the sugar goes into the bloodstream very quickly. There's no fiber to slow it down. The blood sugar starts to go up fairly quickly, fairly dramatically. The pancreas kind of overreacts, releases a lot of insulin to prevent the blood sugar from going too high. Well, the insulin load goes into the blood. It starts the sugar coming down again. This time the sugar comes down, but as it approaches, say, normal at 100 or 90, there is no more sugar in the gut coming into the bloodstream because it's come in so quickly, there's nothing left. So the sugar supply to the blood is cut off, but there's still a lot of insulin in the blood, and that drives the blood sugar too low. This will make a person hypoglycemic maybe an hour or 2 hours after the high sugary meal. And this is where they may get hypoglycemic, have a hypoglycemic reaction, get shaky, tremory. And at that point, they feel a need to have a coffee break. And this is where the 10 o'clock coffee break comes in, people needing to get something to get their sugars up again. They'll take many times a caffeinated beverage, which can stimulate blood sugar rise even without sugar, and then they'll have a sugary meal, which sends the blood sugar up again. This causes a blood sugar drop again, and the cycle is repeated. And this is a cyclic problem then that happens around noon or 2 o'clock in the afternoon after they have a sugary meal at lunch. They get another spike and drop. Then at 2 o'clock they need another sugar fix. Things go up. They come crashing down around 5 o'clock. You have to have a meal, and the meal is another sugary meal, causes blood sugar to go up, and around 7 o'clock comes crashing down. You have to have another snack, and then you go to sleep, and hopefully you can make it through the night without having another sugar dive. I experienced this in college, and it occurred to me at college, I said, this is strange. You know, I used to be able to go from breakfast to lunch without having to have a 10 o'clock sugar fix. And when I went back to a high-fiber diet, plant-based diet, without the sugary spikes, I was able to go from breakfast to lunch without having a hypoglycemic episode or needing the coffee breaks. Another factor in foods that can help even out your blood sugars, especially if you are diabetic, is the concept of a glycemic index. Glycemic index is how fast sugar goes from your gut into your bloodstream. And if this happens slowly, you have a low glycemic index food. If you have a high glycemic index food, the same 100 calories will go into your bloodstream very quickly and cause a sugar spike, and you're at risk for that hypoglycemic episode again. High glycemic index foods, sugar, table sugar, has about the same high glycemic index as refined white flour. White potatoes have a high glycemic index. The low glycemic index foods, which are the best, especially for people coming off of the diabetic state, would be the lentils, beans, peas. These are the legume families. They release their sugar into the bloodstream very slowly over a long period of time. Even sweet potatoes have a low glycemic index. And you can actually go to nutrition books and get tables of foods with different glycemic indexes. They have shown that, or we've experienced, that if you want to even out your blood sugars, if you have a large bowl of beans or lentils for breakfast, 1 or 2 bowls, you'll find that you're able to last from breakfast to usually about 2 o'clock in the afternoon without getting hungry or having those crashes. It's very effective for diabetics and helping them control their blood sugars. Another aspect of foods that can help prevent diabetes are the whole grains. They have found that whole grains can decrease insulin resistance. They also reduce your risk of diabetes and your risk of heart disease. And this is independent of the fiber that's in the whole grains. So we believe that it has something to do with the phytochemicals that are in whole grains, which are removed when you take out the bran and the germ. In processing foods, the grains, the bran, the outside covering of the grain, as well as the germ, are many times removed. And those have over 90% of the phytochemicals. And these chemicals are chemicals your body uses to help prevent diabetes and also help prevent cancers. It strengthens your immune system. You can't get these phytochemicals from animal products. They have to be obtained in your foods. And whole grains are one of the best sources of these, and we believe that's one of the reasons why whole grains can help prevent diabetes. We want to talk about another concept in diabetes now. If you recall, Dr. Anderson was able to get diabetics who were on their pills, about 90% of them off their pills on a plant-based diet. If they were taking insulin, he was able to get about 75% of the patients on insulin off their medications. The question is, why wasn't it 100%? Was there something else going on that was preventing that small percentage from being able to come off their pills? And the answer is yes. There's something that we now understand is called Betacell burnout. Betacell burnout is when the beta cells in the pancreas, which produce the insulin, start burning out. They start being able to produce and release insulin. They have found that unless you have beta cell burnout, the insulin resistance will not progress to diabetes. In other words, in order to get diabetes, you've got to have insulin resistance plus this beta cell burnout. Now, we're talking about type 2 diabetes. They did some baboon studies to illustrate this. They took some normal healthy baboons and they gave them nicotinic acid, which causes marked insulin resistance in the doses that they gave them to these baboons. But the baboons responded by just increasing the amount of insulin they released, and they overcame this insulin resistance. And this allowed them to prevent their blood sugars from going too high. Next, they took some baboons, and this time they destroyed half of the pancreas with a special poison. Now their pancreas was only half there. Now when they gave them the nicotinic acid, the insulin resistance rose. The pancreas tried to compensate by releasing more insulin, but was unable to do so because half of it was missing. And they went on to develop diabetes. So they needed both components to develop diabetes, insulin resistance plus beta cell burnout. They have also observed that in humans there is a particular rare genetic dysfunction which causes a severe insulin resistance. But many times these patients do not develop diabetes because their pancreas is able to just produce more insulin and compensate for it, so the blood sugars can stay in the normal range. What they have found with beta cell burnout is that it occurs or starts to occur 12 years before the diagnosis of diabetes. And this is also where you can find insulin resistance starting to increase. What they're finding is that for about 12 years before the diagnosis of diabetes, insulin resistance slowly starts to increase until after about 12 years, they're then diagnosed with diabetes. What happens as the insulin resistance increases initially is the pancreas just releases more insulin to compensate for it. So insulin levels actually go up until the time of diagnosis, say at 12 years after the start of this process. During that time of increasing insulin resistance, beta cell function is continuing to drop. Now, beta cell function, God has produced us with a big reserve so that a normal person may be able to produce maybe, say, 10 times as much insulin as they would really need. But by the time of diagnosis of diabetes, that beta cell function is 50%. It may only be able to produce maybe 5 times as much insulin or somewhere in that neighborhood. And at this time, the insulin resistance, however, has increased to a point where it may need that much more insulin to keep the blood sugar controlled. So after 12 years, the pancreas can no longer keep up with the insulin resistance, and now the blood sugar starts to rise. And now the doctors say, oh, your blood sugars are rising, and you get diagnosed with diabetes. What causes beta cell burnout? Well, there are many theories. Some thoughts were that, well, high blood sugars would be toxic to the pancreatic cells, or there's some glycosylation of proteins. The sugars would combine with the proteins in the pancreas, and that would cause damage or amyloid deposition. But all of these processes required high blood sugars. And as we've noted, this beta cell burnout occurs 12 years before the diagnosis of diabetes, when the blood sugars are normal. So they had to understand or find a different mechanism, and they found that the mechanism most likely is what they call lipotoxicity. When you have insulin resistance, two things happen. Your triglycerides go up, that's the fat in the blood, and insulin levels rise. Now, insulin not only drives sugar into cells to be burned or stored, it not only drives sugar into those cells to be stored, but insulin will also drive fat into fat cells to be stored. It will drive fat into liver cells, causing fatty liver, but it can also drive fat into pancreatic cells, which can cause beta cell burnout. It could be toxic to those pancreatic cells. What we found also is that this has been confirmed with the Pima Indians and Caucasians. What they found is that if they give a high-fat diet to these groups of people, very soon the beta cell function starts decreasing, and it's related to the fat in the diet, the insulin resistance, and the high triglycerides, and the increase in insulin that is being produced, causing that lipotoxicity in the pancreas. Well, many patients want to know, how do I know if my pancreas is working, or how well it's working? If their pancreas is working well, if they're producing enough insulin, then if we just get rid of the insulin resistance, we would expect to be able to get them off their medications. However, if their pancreas is working at a very low level, where they're not producing much insulin at all, even though you get rid of the insulin resistance, you still have a second problem where you're not producing enough insulin, and they may still need insulin to maintain their blood sugars. So how do I know? How do I know? Well, there is a test called C-terminal peptide, which you can ask your doctor about. You can obtain. It's just a simple blood test. What happens is insulin starts as proinsulin, and it's a protein, and to turn it into insulin, one of the ends is broken off. That's called the C-terminal peptide end. It's broken off and kind of thrown away into the blood, and what's left is your insulin. The insulin goes out and does the work it's supposed to do. But this C-terminal peptide floats around in the bloodstream, and its level can let you know how much you're producing. Now, if I inject insulin, there's no C-terminal peptide in the insulin I'm injecting. So even if a patient is taking insulin, we can measure their C-peptide, and it will tell us how much insulin that person is making, even apart from the insulin they're getting injected. So what's normally done is we give a sugary meal or something to drive the sugar up above 150. This will stimulate the pancreas to release as much insulin as it can. And then, once the blood sugar is above 150, we draw a blood test and we measure the C-peptide level. If the C-peptide level is 4 or above, that generally indicates fairly good pancreatic function, and you would have a very good chance of getting off your medicines if you were to change your diet and get rid of the insulin resistance. If, on the other hand, it's 2 or less, chances are not as good. Chances are less likely that you're going to be able to get off your medications, even if you get rid of the insulin resistance, because you're still going to need to produce more insulin, and that may take some time to correct. Well, the next question that would follow is beta cell burnout reversible? And the good news is there is evidence that yes, it is. There are some drugs, TZDs, they're called. They're a class of drug which helps decrease insulin resistance as well as decrease triglyceride levels, and these two factors tend to increase the function of the beta cell if the medicines are started soon enough. They can increase, and some tests have shown as much as a 60% increase in beta cell function in as little as 6 months. The problem with these is that there are some side effects, and they will cause usually a 5 to 10 pound weight gain during that time period, something most diabetics would like to avoid. On the other hand, if you move to a plant-based diet, you can also drop your triglycerides, decrease insulin resistance, and beta cell function can increase. It may take 3, 6 months, 12 months. It may take some time for that beta cell function to increase, but if a person persists on it, this is something that they can hope for and actually measure and follow and see if the pancreas is indeed getting better. The nice thing about a plant-based diet is it does not cause the weight gain that the TZDs would cause. In fact, it can cause, in general, a weight loss. And that's something that, again, most diabetics are looking forward to. Well, at the beginning of our first talk on diabetes, we described a lady who came into our office, and I wanted to tell you the rest of her story. If you remember, her name was Tony, and she came into the office. She rolled in a wheelchair, 5'3". She was actually 325 pounds. She was blind from her diabetes. She was on 44 units of insulin a day. She had high blood pressure. She had high cholesterol. And as you now know, this is all part of the insulin resistance syndrome. It's part of the insulin resistance that she has, and it was causing all of these problems. She had the blindness was from a diabetic retinopathy, a common side effect of diabetes. Well, I shared with her basically the things that I shared with you, and she did something very strange, very unusual, something we weren't really expecting. She actually did everything we asked her to do. She was in a wheelchair. She wasn't able to exercise or get around much at all, but she moved to a plant-based diet. No calorie restriction, in a wheelchair, no real exercise. But within about 2 months, her blood pressure started coming down. And as the blood pressure comes down, we had to start taking her off her blood pressure medicines, or it would go too low. In about 2 months, she was off of her blood pressure medicines, not needing that anymore. She continued on her program, and we had to start decreasing her insulin level, her insulin doses, because her blood sugars were starting to go too low. Her blood sugars started coming down, and also we followed her cholesterol levels. Her cholesterol levels started coming down. At the end of 1 year, her cholesterol had dropped so low that we had to take her off of her cholesterol medicines. And at the end of a year, she was off of her insulin. She'd gotten off of her insulin. She was just on some oral medications at that time. The other amazing thing we found was that her weight started dropping. She went from 325 down to 211 in 2 years. That was approximately a pound a week with no calorie restriction, no exercise. She was in a wheelchair, and just by changing to a plant-based diet. She was then able to get a knee surgery from an orthopedic surgeon, and she started walking again. And as long as she stayed on the program, her blood sugar stayed good, blood pressure stayed good, cholesterol stayed good. If she strayed off the program, started having the animal products again, blood sugars would start to rise, cholesterol rise, blood pressure would rise, weight would rise. She'd have to come back on track to even it out again. And she did very well as long as she stayed on the program. So the take-home message is that what we found is that on an animal-based diet, American diet, a lot of fats will go in and plug up those insulin receptors so that when you take a sugar or starch, blood sugar goes up, insulin's released, can't get in the keyholes, doors are shut, and the blood sugars rise. That's insulin resistance. When this happens, the pancreas compensates by releasing more insulin. That insulin tends to drive fat into fat cells, making people heavy, drives fat into liver cells, causing fatty liver, drives fat into pancreatic cells, causing beta cell burnout. And with time, the beta cells will start to burn out. You'll have decreased production of insulin, and with time then you will have both beta cell misfunction, not enough insulin being able to be produced to compensate for the insulin resistance that the American diet has. If you choose, like Tony did, to go on a plant-based diet, this can reverse. Insulin resistance generally reverses within 3 or 4 days, sometimes a week or two, usually 3 or 4 days. Beta cell function, on the other hand, may take 3, 6 months or longer before it can recover and recoup. So for patients who are on diabetic medications, wanting to make a change, we encourage you to work with your doctor. Say, I'm going to try a lifestyle change. I want to be letting you know what my blood sugars are, and as the blood sugars come down, stay in touch with your doctor so he can adjust your insulin so that your blood sugars don't go too low. You want to keep in touch with him so that you can make those adjustments as needed. And as you make these changes, what should occur, what you should be watching for is blood sugar should be dropping, blood pressure should be dropping. You would need to keep your doctor appraised of those so that if needed, he can adjust your blood pressures down. Weight should be dropping, cholesterol levels should be dropping. And again, it would be good to keep a check on your cholesterol, because if you're on cholesterol medicines, you do have a good chance of being able to get off your cholesterol medicines. So you want to keep in touch with him, keep him appraised, so that you're not over-medicating yourself. These are things that God has given us, the plant-based foods, which can strengthen the body and in many cases reverse and heal the body even after many damage has been done. As we move back to the original diet that was given to us in the Garden of Eden, we find that many diseases and illnesses can in fact reverse and improve. So I encourage you to take a challenge, try some of these lifestyle changes, and I wish you God's blessing and His health, for He does desire you to be in good health. We thank you for listening, and we hope that you can experience the health and strength that God desires you to have. Again, thank you for listening. We hope you'll tune in again next time for more talks.